introduce to you my husband for almost 20 years. He's also been a medical doctor for almost 20 years, and he supports and endorses the oils. So I asked him if he could join us. He has an opening, so he's on the call at the moment, and his name is Riaan Steyn. And Melifie, oor na jou. Kan jy my
Baie
hoor?
dankie. Ek kan jou hoor, kan jy my hoor?
Ons hoor jou.
Wat sê Afrikaans of Engels?
Engels as jy kan, Afrikaans is ook goed. Almal verstaan min of meer, anders vertaal ons net nou.
Riaan,
Good
kan jy
morning,
jou video aansit? Ek sien dis af op die oomblik.
Ja.
Die ander knoppie, jy's nou gemute. So daar's twee knoppies, die kamera en die mikrofoon.
So he usually does live consultations, not Zoom consultations. Het jy dit reg gekry, my lief?
Daar's hy. Gaan maar voor.
Okay.
Daar's hy.
Is ek op?
Ja. Welkom Riaan.
Dankie, dankie. Good morning, everyone. Yeah, as Riaan said, I'm a general practitioner in Bloemhof for almost 20 years now. Essential oils is quite a non-Western thing for doctors. I always tell the story that what we learn at varsity regarding essential oils and alternative medicines is a 3-4 page booklet that we spend about an hour or so on it, and that's it. So when Riaan started, it was quite a new thing. I had concerns regarding the use in practice, concerns regarding the safety of the essential oils and how regulated the product is, because if I start to use it or consider to use it, obviously I would like to have something to go by, say what is in one drop in this bottle is the same as in every drop of every bottle, which doTERRA is, to say, but I'm glad to use it. Can it fulfill everything in my practice? No, it cannot. Obviously, you cannot go and close your files at your local GP yet. You are still going to use him, to need him from time to time. From a personal point of view, it's easier to experiment on myself and than on patients and in our family. It's just the ethical thing to do. I can experiment on patients. Do I use it in the practice? Yes, I do on certain selective cases with consent of the patient, with extreme good information and consent that the patient know what they are in for. And that is more or less cases at this stage for what neither me or any other specialist rather as an answer for certain things. But I'm not going to go too much into that for now. Again, we are talking about Copaiba today. And I rather start to give you of a personal testimony. I have a very painful right shoulder, which is a chronic inflammation in my bursa on the front end side, on the anterior side, and I've consulted an orthopedic surgeon last year, and I was actually scheduled for surgery, but I just was up to it because it was just before we're going on December holidays, and I just didn't, was net nie lus vir dit nie, to be with a painful shoulder during my holiday. I had that experience previously in my life, so I wanted to just be free. So the long and the short, Riaan started me on a mix of Copaiba and turmeric and frankincense and I don't know what else she's putting in the glass every night. And so I was giving this potion. I'm still alive today, but this potion she's giving me every night for the past, month, 3 months plus. And while we were on holiday, we just stopped using it. I probably just a little bit lazy and in the holiday mood and not in the same routine every night. So as we got back from holiday, I told her, yo, but my shoulder is all of a sudden extremely painful now. Was it, to be honest, I didn't really realize the pain is actually going. I was continuing with normal life. And so we started with a potion again, since we're back from December, and now we're in February already. And I told her just yesterday or day before, I don't think it's necessary for the surgery anymore. My pain is almost completely gone. It came from a stage where I couldn't have used the shoulder. I'm farming as well. And when we are busy on the farm, there's just no way I can pick up stuff, or I can help when we are working on stuff, just too painful. And it was at a stage where I had to drink anti-inflammatory tablets every day, 3 times a day, just to get rid of the pain. I injected myself with cortisone into my shoulder at a stage it was just helpless or moedeloos about the pain. So yes, it is definitely working, but it's not a magic wand that you can think you're going to take 2 drops and it's gone. I think the lesson for me is it's continuous usage. But the question I want to ask, what is the difference when I prescribe patient with chronic pain? Yeah, I also prescribe chronic anti-inflammatories that they have to use every day for a month up to 3 months. So there's not much of a difference there. So I just think this is safe on my stomach. I don't have the risk of developing a peptic ulcer or upper GIT bleeds. It's definitely working. And while we stopped for the 2 weeks on holiday, I could feel my pain is back. So it's working. Give it a go.
Dankie my liefie, dit was perfect. Thank you.
All right.
We appreciate your time.
I'm gonna run. Bye-bye.
Baie dankie Riaan.
Bye-bye.
Bly.
I think that summarizes everything, especially if we speak about side effects with modern medicine and Western medicine. Obviously, I just took my child this morning for surgery. Modern medicine is definitely necessary, and there's a place for that. But the lovely thing about the oils is, if we speak about integrative approach, where you can combine the two. And then the side effects of addiction, the side effects of ulcers, etc. On Western medicine. If you have an alternative that's safe, if you have an alternative without side effects, why not use it? And that brings me back to price again. So if you think it's an essential oil that you can get from Dis-Chem or Clicks or whatever on the shelf, and you pay 60 or 70 Rand for that, that's the wrong expectation. This is much more. This is science in a bottle, art and science blended together in a bottle. So I hope you found it interesting, and I hope Copaiba is going to change your life. So if there is one oil, actually, I was thinking this morning, I know frankincense is the king of oils, right? I know that. Frankincense is great. But I tend to say, if I had to choose between the two, I would actually choose Copaiba. Maybe I'm wrong. I'm not a scientist. But for me personally, I prefer Copaiba. You can't replace them, obviously. But if I had to choose one, I'd choose Copaiba.